Hi, my name's Brianna Jacobs, and today I'm going to be talking about Cotard syndrome. In Phantoms of the Brain, Ramachandran describes Cotards as a patient thinking that they are dead, including delusions about their skin rotting or maggots crawling all over them. He postulated that it could be related to capgras, and that instead of simply losing facial recognition capabilities, the patient has lost the connection to all of their senses. In a 1995 issue of Comprehensive Psychiatry, I found a historical review that explained that Cotard syndrome, or delusion, was named for a French physician, Jules Cotard. Though he is known for researching the condition, he was not the first to describe its symptoms. Cotard believed that the delusion was related to depression. In fact, he described it as a nihilistic delusion, or anxious melancholia. Later, he connected the syndrome to people's loss of mental vision. Cotard died in 1889. But not before sparking controversy about the nature of Cotard's delusion. However, most physicians and researchers still preferred a symptomatic description of Cotard's up to and beyond World War II. According to a review of the disorder in a 2012 issue of Neuropsychiatry, current understanding of Cotard's is that it is just one piece or symptom in another underlying condition. Women are more likely than men to develop the disorder, and most people with Cotard's are over 45. It has also been associated with numerous conditions, such as manic depression, mostly in younger people, brain tumors, temporal epilepsy, and Parkinson's, just to name a few. Brain scans do not indicate any one universal structural brain change in Cotard sufferers, according to the aforementioned neuropsychiatry article. However, it is noted that prefrontal dysfunction seems to be related. Since Cotard's presents with a variety of different disorders, both psychiatric and somatic, it's difficult to pinpoint what is happening in the brain when it occurs. One case study in particular attributed the onset of the disorder to lesions in the left hemisphere, specifically in the frontal, parietal, and temporal lobes. The most widely utilized treatment for Cotard's is electroconvulsive therapy. However, due to its presentation occurring often in conjunction with major depressive episodes, antidepressants are commonly used as well. Is Cotard's an exacerbated or related form of capgras, as Ramachandran assumed? There are multiple case studies which report patients presenting both disorders simultaneously or in succession. The similarity between the disorders seems to be in the patient's experience of dissonance or depersonalization, or a general feeling of strangeness. This is hypothesized by some to be related to a dysfunction of the anterior insula, which deals with, among other things, emotional awareness. The anterior insula is located, as we know, deep within the lateral sulcus. Its connectivity to the limbic area affects emotional responses, and it also plays an enormous role in the resting state network, integrating information to contribute to the individual's overall sense of self. Some have speculated that this dysfunction in the resting state network, particularly during manic depressive episodes or major depressive episodes, is associated with spatial temporal disturbances, which contribute to a sensation of dissociation and time slowing. You can see how this would be applicable in a disorder such as Cotard's, when people feel that they are not themselves, or dead, or slowly dying. Further research and fMRI studies should bring a better understanding of the nature of this disorder, but there is still much that is not known. However, we definitely have come a long way from the simple symptomatic description of the disorder.